So in terms of physician notes, we have the medical notes, and this is a sample which is provided on venturafamilymed.org website. It's similar to what most of us use, and just took it from there for ease. History and physical examination. Obviously you start the initial description with something like newborn baby, boy or girl, born to the mother's age, gravida para, and gestational age in weeks. Then the initial complaints before delivery, presented in labor, presence or absence of Schramm. If there was Schramm, you would write the total time with the ruptured membranes. Then the delivery mode, whether the baby was cephalic or breech. This has implications in terms of your planning future ultrasound hip, for example, if it's a breech delivery, and whether it was a cesarean section, whether there were instrumental deliveries, and so on. Delayed cord clamping is part of the NRP guidelines. It's very important we mention whether it was done or not. This is more important in the premature babies, as we have discussed in the different videos on delayed cord clamping. And we mentioned the resuscitation measures and the Apgar score at 1 and 5 minutes. And of course, if the baby needs resuscitation, you would have an extended Apgar score. It's also good practice to have the expanded Apgar score. You may refer my video on that, where we write in clear details of each aspect of the scoring, so it's clear to the people who are observing what has been the actual score. We also cover the maternal details, including the blood group, antibody, whether there is any Coombs positive, indirect Coombs, the hemoglobin of the mother to suggest if there is any anemia in the mother, infection screen including rubella, varicella, VDRL. Urine culture is very important. Sometimes you get ESBL organisms which may cause sepsis in the premature baby, so you may have to broaden your cover in such cases if the baby is symptomatic. Hepatitis B, HIV, and maternal serum alpha fetoprotein, as well as if the triple test was done for trisomy and other tests as relevant. The glucose tolerance test, obviously they would have told you if the mother has gestational diabetes or type 1 diabetes, and you would also need to know about the screening for the glucose tolerance. Group B streptococcal status is routinely done in the Western countries and in UAE and other Middle East parts, but it may not be done routinely in many parts of India. The incidence of GBS in Indian setup is still not clear. The complications of pregnancy should be clearly documented, any pertinent family history, and antenatal scan findings. It's very important to be clear about what maternal details. You need to discuss with the obstetric team, and especially if there is a community obstetrician who is delivering in your unit, we should try our best to get the results scanned into the system, so we have the results which are important at delivery. Many times we suggest a pediatrician high risk box in the mother's notes, and high alert important results would be entered there, so it's clear to the